Vidant Spotlight right now. Just getting to know Dr. Paul Mounsey, who is the new Chief of Cardiac Electrophysiology at Vidant Medical Center, and an interesting gentleman. And I love the accent already because we just established that you probably didn't grow up in Eastern North Carolina. Good morning, sir. How are you?
I'm really good, thanks, and very happy to be here. And yes, you're right. I did not grow up in Eastern North Carolina, but I got to tell you, I'm real happy to be here.
Well, it's great to have you here. Now, are you a Brit?
Originally a Brit, yes.
Yeah.
I moved to the United States back in 1993, and I now get to vote in federal elections, which means that I'm a citizen. The only thing I can't be is the president.
Yeah. Well, it's great to have you here, and I've heard great things about you. You and I have mutual friends. We were just talking about that a moment ago. Well, let's start with what it actually is. Some of the things that we've heard of that you work with are a little more known to us than the term cardiac electrophysiology. So tell us what you do.
Okay, what is it about doctors that we've got to couch really simple things in really long, difficult words? What I am in English, is a heart rhythm specialist. I'm a cardiologist, which means that I have looked after people with chest pain and breathlessness, just like cardiologists do, but I specialize in heart rhythm disturbances. And you know, the heart can go too fast or it can go too slow, and we can treat heart rhythm disturbances with pacemakers and with defibrillators, and we've been doing that, and there are exciting things we could talk about in the pacemaker and defibrillator field, and Vidant and East Carolina University have a long history of doing great things in this field. At the other end of the field, though, and the more exciting end of what we do, is we do a lot of minimally invasive surgery to treat heart rhythm disturbances. I think probably quite a few of your listeners have heard of atrial fibrillation. And we can manage atrial fibrillation with catheter-based operations by burning out electrical short circuits in the atria, that's the upper chamber of the heart. We can also treat many other arrhythmias in that way so that people can have their heart rhythm disturbances controlled without needing to be on high doses of toxic medications.
So there is a surgery for someone that has atrial defibrillation?
Fibrillation.
Atrial fibrillation. My father had that.
Uh-huh.
And I know that back in, of course, he's deceased, but I remember they would shock him, trying to get him back into rhythm. But
Sure.
there's some new things since then. What you're talking about, this minimally invasive surgery. Talk about that. What do you do for patients these days that have atrial fibrillation?
Yeah, and I think the answer is a range of things. At one end, we can certainly do the traditional electric shock, which I would call a cardioversion.
And let me stop you for a quick second, because I'm assuming that people know what atrial fibrillation is, but maybe you should say first what that actually, how does that translate to what's happening to the patient?
Sure. The heart has upper chambers and lower chambers. The upper chambers are the atria. They collect blood from the circulation and shoot the blood down into the lower chambers called the ventricles. The lower chambers pump the blood out to the rest of the body, and they are what generates the pulse. The upper chambers, the collecting chambers, govern the heart rate, and when your heart needs to go faster, the upper chambers of the heart go faster, and the lower chambers follow the upper chambers like a dog on a leash. When atrial fibrillation happens, the upper chambers of the heart stop beating and begin to vibrate at about 600 beats a second. I see 600 beats a minute, rather, which means that they're not really transporting blood, and the poor old main pumping chambers of the heart don't know how fast to beat, and so the heart is sometimes inappropriately fast, sometimes inappropriately slow, and always irregular.
So we hear that term a lot these days, and it's not that uncommon. I know President H.W. Bush had atrial fibrillation.
Absolutely.
I mentioned my father had it.
Yeah.
I have friends who've had it. And so it's pretty common.
Probably 10 million Americans have atrial fibrillation at the moment. Quite a lot of them are quite elderly, and many of them are not terribly incapacitated by it. But there are many hundreds of thousands of people living in the state of North Carolina who have atrial fibrillation and who are quite symptomatic, quite incapacitated with it, both from palpitations, that means the sensation of your heart thumping too fast in the chest, but more commonly, they're symptomatic with breathlessness and tiredness.
So back to how you treat it these days. You were
can give somebody a cardioversion, and that will put the heart into normal rhythm now. but will not usually maintain the heart in normal rhythm. You need to give a drug or something else. And at the other end of the spectrum, what we can do is we can thread instruments through the veins at the top of the legs up into the heart, and we can identify the electrical short circuits in the heart that are causing the atrial fibrillation and burn them out. And that's called a catheter ablation procedure. And we can sometimes ablate burnout tissue with freezing it with liquid nitrogen, and we can sometimes burn out tissue with heat, and that's sometimes called a radio frequency ablation, because the energy we use to heat the tissue up is radio frequency. And your patients, your listeners may have heard of both of those techniques. And that, if you like, is the exciting end of what we do. But then you may say, well, why Eastern North Carolina? And the reason is not just that we have a very good cardiac department here with very good people in charge of it. Dr. Ian Antoni and Dr. Blaise Carabello are certainly putting a wonderful group of people together. But also one of my ex-collaborators, I used to work in Chapel Hill, and one of my ex-collaborators there, Dr. Andrew Kaiser, who's a cardiac surgeon who heads up the cardiac surgery program here, and I have worked together for getting on for 10 years doing combined operations, where in addition to the catheter-based operation I can do, he can do a minimally invasive operation from outside the heart. And if you add those two operations together, we've probably done more of that than most people anywhere.
It's very exciting to hear about the kind of things that are going on at Vidant Medical Center with the Heart Center and the Heart. And I remember when you came here, there was a big to-do about the fact that we'd gotten one of the top guys from UNC Chapel Hill to come to Vidant Medical Center, and I was very excited about it. And I'd again, you and I have mutual friends, so I'd heard a lot of good things about you. So it's very exciting to meet you and hear about the great work that you're doing over there. We're doing some unbelievable things here in Greenville with medicine these days. I
would agree with that, and thank you for your kind words. I would agree with that, and I think that sometimes we don't toot our horn loud enough, because when you look at what we can achieve in Greenville, for example, in my field of heart rhythm disturbances, you don't need to go to any other hospital to have anything done about your heart rhythm. You don't need to go to Harvard. You don't need to go to the Mayo Clinic. You don't need to go to Duke. We can do whatever you need to have done to a heart rhythm right here in Greenville. And as I said, Mark Ian Antoni and Blaise Carabello and Andy Kaiser are putting together a really great team of people. And anything that needs to be done can be done.
Exciting stuff, exciting stuff. Now, is there a website or something we can learn more about what you're doing, or just go to the Vidant Medical Center?
If you go to the Vidant Medical Center website, we're just in the midst of constructing a website about the arrhythmia service, the heart rhythm service.
So there'll be more to come.
And there will be a lot more to come. We're kind of recruiting a team at the moment, a team including nurses and advanced practice providers and more doctors to try to really expand the reach of the program.
Very exciting stuff. Thank you for taking the time to come see us.
Okay, it's a pleasure.
I hope to see you more, but I hope I'm not a patient.
I'd be delighted to see you in either way.
Nice to see you, Doc.
Very good
Appreciate
to see you,
Dr.
too.
Paul Mounsey, the new director, I'm going to have to look at my notes to get it right, the new director of cardiac electrophysiology at Vidant Medical Center, which means if your heart is having rhythm issues, this is the man you want working on you for sure.
Well, thank you.
Thank you,
you
sir.
Very much.